It's something you hear a lot about this time of year, Medicare's annual election period. Bill Green is the owner of Green Insurance, and he's here to break things down for us. Thanks for joining us again.
Thank you.
Let's talk about the enrollment period. When exactly is that?
So we have two enrollment periods this time of year. The first is Medicare. It started on October 15th and it runs through this December the 7th. The other one we have starting fairly soon is the Marketplace or Affordable Care enrollment. That runs normally November 1st through December 15th. This year it's going to run through January the 15th.
Okay, so since we're in the Medicare annual enrollment period, what should people be doing right now?
At this point, you should have already heard from your agent or broker.
Okay.
We reached out to our people early in September. Again, you should have heard from your agent, whether it's by mail, email, phone call, text message, carrier pigeon, something. They should have reached out to you by this point.
Right. Okay. So then are there any changes or anything new we should know about?
Yes, there are several. The first is Medicare's released their numbers for next year. The Medicare Part B premium is actually going down.
Oh.
It's going to go from $170.10 down to $164.90. Other changes, the Inflation Reduction Act has reduced our costs for Part D vaccines. A big one for that is shingles.
Oh, yeah.
And then we have some new plans coming to town.
Okay, let's talk about some of those.
Yeah.
What can we expect?
So we have some new plans coming to town. Some of them look very attractive.
Okay.
What you want to look for, though, is make sure that your doctors and your medicines are covered well in these plans.
Right.
Again, they look very attractive from the outside looking in. We are appointed with every plan that allows a broker to work with them. So as long as you reach out to us, we can help you find the right plan.
Okay, so then we've talked a lot about Medicare, obviously, but what about healthcare marketplace, and is there anything we need to know in terms of that?
Yes, the marketplace opens up on November the 1st. We can't see plans until November the 1st.
Oh, okay.
There are two big things happening with that as well, or really three. One is the subsidies are continuing into next year, the increased subsidies. So a lot of people are surprised they can actually receive a subsidy when they thought they'd never be able to. Another one is we have a major plan leaving the area, or leaving really nationwide. It's a plan I'm currently on. It's called Bright Health.
Okay.
They're completely pulling out of the marketplace. So if someone has that plan, they've got to shop their plan for next year. They don't have any choice.
I see.
And then something that's exciting is we have a new plan coming to town. We have Aetna. And that's another a major brand. We don't know what the plans and network's going to look like at this point, but we're hopeful it'll have a lot of good doctors in it.
Okay, so if someone has more questions then, because like you said, it looks attractive from the outside, but you might need to go in a little bit deeper with someone who really knows more about it.
Right.
If they need to get in touch, how can they do that?
Can call into the office. That phone number is 904-717-1176. Or you can visit our website. It's greenins.com.
All right, wonderful. Well, thank you so much for joining us today.
Thank you.
And I can't believe it's already getting towards the end of the year. Oh my
I know.
goodness. And if you'd like to see this segment again, just head to our website at firstcoastliving.net.